Hey everybody, I'm Dr. Seth Eberlin. I'm a board certified plastic surgeon here in Walnut Creek, California. And today I'm really excited to talk about a new breast augmentation technique called Preserve. Now, in order to talk about what Preserve is, we kind of have to talk about what it isn't first. And what it isn't is just a small kind of slight difference between a traditional breast augmentation and Preserve. It's a totally different way of doing the procedure. And because of that, it does afford us to have what we think are better results, much better recovery, and a better long-term outcome. So first of all, let's talk about a traditional breast augmentation is. A traditional breast augmentation, we typically make a 4 to 5 centimeter incision, go in, create a tissue plane, kind of release the tissues. You have to cut through some muscle. You create the space for the implant. You put the implant in, you sew everything up. Now, this isn't to say that that doesn't still work very well, because it does. It's still an incredibly tried and true method. It's done thousands of times every day throughout the country. However, we think that there is a better way to do it for certain patients. So the issues with the traditional breast augmentation is you're not respecting the normal breast anatomy and you are disrupting a lot of it. And when you're disrupting that breast anatomy, the ligament that attaches the breast to the chest wall at the bottom of the breast is released and relaxed. What that does is it creates more ability for the breast to kind of descend and get saggy over time. With this Preserve technique, that anatomy is respected, so you don't have the opportunity for that breast to fall as quickly, which is exactly what we're looking for. So what the Preserve technique is we make a little incision underneath the breast. We use ultrasound guidance to go right above the muscle. And through that tunnel that goes right above the muscle, we insert this little balloon. Now, what this balloon does is, once it's in place, we gently inflate it. And once it's inflated to the size of your implant, we leave it there for a little bit. And that lets the tissue kind of relax and create a little nest for that implant to sit in. Once that's been there for long enough, we're able to deflate that balloon, take this device out, and put the actual implant into the pocket and let it kind of settle and stretch that tissue. The benefit of that is you're not disrupting the ligament at the bottom of the breast. You're not disrupting all the connective tissue inside the breast. You're not disrupting the blood vessels. You're not disrupting the nerves. So everything about the breast tissue anatomy is respected. In doing that, it allows your body, the implant to kind of recruit your breast tissue up to where we want it to go. Because with a traditional breast augmentation, if somebody has a nipple that is a little bit down and a little bit outwardly displaced, the implant has to be a little bit down and a little bit outwardly displaced to allow for the implant to sit right behind the nipple. With the Preserve technique, because we're not disrupting your breast tissue, what we can do is we can put the implant in a little kind of higher, more medial position that aesthetically looks better, and that will recruit your breast tissue to get and sit up on top of the implant, so you have a better long-term result with less disruption of the breast tissue. Now, one thing about that is when we're doing it, you're not creating a big open space for that implant to float around in. It's a pretty tight little nest that the implant sits in until that ligament and that tissue relaxes and the implant can kind of sit in its normal position. And this kind of leads us to the recovery of it. Now, the recovery of this procedure is physically much easier than a traditional breast augmentation. You have significantly less pain, you have significantly less downtime. You're able to move completely right off the bat, and people can get back to their lives very quickly. I'm talking 5 to 7 days after surgery, you're feeling pretty normal. I've seen this procedure done where an hour after the procedure was finished, patients were walking out of the door saying, "I feel fine, I'm doing great." And that's just not something we see with a traditional breast augmentation technique. Another thing that contributes to that actually is the anesthesia that we use. With a traditional breast augmentation, typically patients are undergoing general anesthesia. It's a longer kind of recovery in the recovery room, and it takes a day or two to kind of get out of that groggy window. With Preserve, because we're respecting your tissue more and we're not disrupting as much of it, it's much easier to do this under much less anesthesia, which means less sedation, which means a much quicker recovery, kind of getting back to yourself. However, because we're using that nesting technique and that implant sits a little bit higher and tighter, it does take a few weeks for that tissue to relax and for that implant to kind of be able to sit in its normal position. Now, that's not something that is super different from a traditional breast augmentation, because the traditional breast augmentation does have the normal kind of fluff and drop period, but it's just a little different with the Preserve technique. The other kind of part of the recovery of this is your arm range of motion should be pretty darn normal right off the bat. We're not disrupting the muscle, we're not disrupting a lot of tissue planes. So arm motion, arm strength, all of that gets back very quickly. And people can get back to exercise usually starting within a week or two. They can kind of get back to it and start moving and getting back to their normal everyday activities. So leading us into the next kind of option, which is who's a good candidate for this? Good candidates for this are typically patients who have a tighter skin envelope, meaning they don't have a lot of sagging or ptosis, um, patients who have smaller breasts and also have a smaller goal in mind. They're not looking for an overly augmented look. Because Preserve uses smaller breast implants, this isn't something for somebody who wants to have that overly done look. With that being said, if somebody came in for a traditional breast augmentation and was going to use a 300cc implant, with Preserve, we'd be looking at around a 200cc implant or maybe a 180cc implant. We can really step down the amount of volume that we need to add because we're recruiting your own tissue to do the work that we want it to do. Other good candidates for this are patients who are busy and want to get back to their life quickly, patients who really don't want to undergo general anesthesia because it can be a little scary, which it is, patients who are moms who say, look, I got to get back to my life. I have to be able to pick up my kids. I just want to be able to do this procedure, enjoy the results, but not have all the downtime of a tradition or kind of side effects of a traditional breast augmentation. Now, the potential risks are similar with any procedure. And the implant related complications, because we're using Motiva implants, are much lower than most other implant companies. The risk of rupture, the risk of capsular contracture or scar tissue building up around the implant, the risk of palpability or malposition, all that is much lower because we're using what I think to be really high quality implants and what is a incredible new technique in breast augmentation surgery. Now, one thing with this is if you are a patient who has a really thin upper pole skin envelope, Preserve can still be a really good technique for you, even though we're going on top of the muscle. Going underneath the muscle did afford a little protection on the top of the implant. So for somebody who has really thin skin, this could work. The on top, or excuse me, under the muscle tended to be the best procedure previously. With Preserve, you can absolutely still go on top of the muscle using that ultrasound guidance. However, in some cases, we may want to do a little fat transfer to that upper pole to help to blend and smooth that transition a little. Now, this isn't to add a lot of volume. It's not to make things bigger, but what it really does is it helps to shape everything and make it look better all around. So in the end, if you're somebody who has been thinking about a breast augmentation, but you've been scared off because of the recovery, you've been scared off because of the incision, you've been scared off because of the actual procedure, the anesthesia, the Preserve technique can be a really good option for you because it really helps to alleviate a lot of that stress and a lot of that worry. So like we talked about in the beginning, this isn't just a small shift in a breast augmentation technique. It's not a different nuance to it. This is a true paradigm shift where we're looking at a very different way of doing this procedure that comes along with respecting the anatomy without disrupting more of your tissue and without disrupting more of your life. So if you have any questions about this, you can always reach out in our DMs or call our office and come in for a consultation. Thank you.